All right, today we're jumping into cataracts, one of the most common and, believe it or not, one of the most successfully treated conditions in the entire world. For a lot of people, it all starts with just a tiny, subtle change in how they see things. You've probably heard it described just like this. It's really the perfect analogy. It's this gradual, persistent fog that just sort of blurs the edges of your world, making things you do every day, like reading a book or especially driving at night, a real challenge.
So what is actually causing that fog inside your eye? And, maybe even more amazing, how on earth have we developed a procedure that's so routine it can get rid of it in about the time it takes to watch a sitcom? Okay, let's get into it.
To really appreciate the fix, you first have to understand the problem. So, let's break down exactly what's happening behind the scenes, inside that foggy window.
It all comes down to the natural lens inside your eye. Think of it as the camera lens for your brain. It's this amazing little structure that focuses light, and it's made of just water and these special proteins called crystallins. Now, normally, they're arranged perfectly to be totally transparent. The problem starts when that perfect arrangement gets messed up.
Okay, here's a great way to picture this. The proteins in a healthy lens are kind of like a raw egg white. They're clear, you can see right through them. But over time, things like age or too much sun exposure damage those proteins. They start to clump together and they basically cook, turning from clear to cloudy and opaque, exactly like an egg white in a hot pan. That cloudiness is the cataract. That's the fog.
And look, if you're thinking this is some rare condition, it's not. It's an incredibly common part of aging. I mean, by the time you hit age 80, there's better than a 50-50 chance you'll either have a cataract or you've already had the surgery to fix one.
Okay, so that's the what. Now let's talk about the how. How does this actually feel day to day, and just how widespread is this issue around the globe? We're going from the personal experience to the bigger public health picture.
And the thing is, these symptoms can be really sneaky. They just creep up on you. So besides that general fogginess, you might notice that oncoming headlights at night seem way too bright, maybe with big starbursts or halos around them. Colors can start to look kind of washed out or yellowed, and you might find yourself heading to the eye doctor way more often, thinking you just need a new pair of glasses again.
Now, let's zoom out for a second and look at the global scale, because this is where it gets staggering. Right now, around the world, more than 95 million people are visually impaired or even completely blind just because of untreated cataracts. That is a massive, massive number. And get this, cataracts are responsible for half of all cases of blindness in the world. 50%, it's the single biggest cause. But, and this is the most important part of this whole story, it's fixable. For most people, this blindness is completely reversible.
And that word, reversible, that's a modern miracle. Seriously. To appreciate just how amazing today's surgery is, we have to take a quick trip back in time. And let me tell you, the history of treatment was pretty brutal.
For thousands of years, the only real treatment was this terrifying thing called couching. A surgeon would take a sharp needle, with no anesthetic, mind you, stick it right into your eye, and just poke the cloudy lens and shove it out of the way. It was crude, but it let some light back in. Then, around the 1740s, they started actually removing the lens, which was a big step up. But without a replacement lens, patients needed these incredibly thick Coke bottle glasses just to function.
I mean, the difference is just night and day. We've gone from these high-risk, frankly barbaric procedures that barely worked, to a modern surgery that's incredibly precise, extremely safe, and can fully restore a person's sight. It is truly one of the great achievements of modern medicine.
Okay, so now for the main event, that 20-minute miracle. Let's pull back the curtain on what actually happens during this incredibly common and absolutely life-changing procedure.
Let's just look at the numbers here, because they really speak for themselves. The surgery itself usually takes about 15 to 20 minutes, and the improvement in your vision, you'll likely see a huge difference in just 1 or 2 days. It's that fast.
Okay, so here's how it works. The fancy name for the modern technique is phacoemulsification. I know, it's a mouthful, but it's simple. Phaco just means lens, and emulsification means to break something up. The surgeon makes a tiny, tiny incision, like 2 or 3 millimeters. They insert a small probe that uses ultrasound, high-frequency sound waves, to gently break apart that cloudy lens. Then they basically vacuum out the little pieces. And finally, a new, clear, artificial lens is folded up, slipped in through that same tiny incision, and it unfolds right into place. It's amazing to watch.
But wait, it gets even better. This is where you get this incredible 2-for-1 deal. That new artificial lens they put in,
It can be made with a specific prescription built right in. So the surgery doesn't just get rid of the cataract, it can also correct other vision problems you've had for years, like nearsightedness, farsightedness, or even astigmatism.
So when you get that new lens, you actually have choices. The standard lens, a monofocal, gives you crystal clear vision at one distance, usually for things like driving, but you'll probably still need glasses for reading. If you have astigmatism, a special toric lens can correct that. And then there are premium lenses that can give you a whole range of vision, often meaning you can say goodbye to glasses altogether.
All right, the surgery's over. It was quick. Now what? Let's talk about the recovery process and take a little peek at what the future holds for vision correction.
The good news is, recovery is usually super straightforward. Your vision will start clearing up pretty much right away, usually within 24 to 48 hours. You'll use some eye drops for a few weeks to prevent any infection and help with the healing. The doctor will tell you to avoid any heavy lifting for a little while, but by about 4 to 6 weeks, you're typically fully recovered.
Now, I really want to land this next point because it's so important. This is a permanent fix. The natural lens that got cloudy, it's gone. The new artificial lens is made of a material that can't get cloudy. So once you've had cataract surgery, the cataract can never, ever grow back.
And you think that's cool? The future's looking even brighter. Literally. The technology is just getting better and better. We're talking about lasers that make the surgery even more precise. There are new lenses that are light adjustable, meaning the doctor can actually fine-tune your vision with a UV light after the lens is already in your eye. And AI is being used to make the calculations for which lens you need just about perfect.
So that's the big question, isn't it? Where does this all lead? We're already moving beyond just fixing a problem. We're heading into an era where we can design truly personalized, perfect vision for almost anyone. It's a mind-blowing thought, and honestly, that future is a lot closer than you might think.